We have Nancy Blair from Cleveland Clinic Foundation and Rebecca Fenton from Beth Israel Medical Center. So I thought I'm going to join you at here. And maybe in the beginning, each of us can say a few words about our experiences in interacting with families of our patients with pulmonary hypertension. And I think we should have a disclaimer. We're all treating adult patients mainly, but we'll be happy to touch upon interaction with families who have kids with PH. So you want to start?
Sure. I work with primarily adult patients. We have about 300 to 400 patients at Beth Israel, New York. We care for over between 300 and 400 adult patients. And I also am responsible for running the support groups. So that's really mainly, aside from the clinic setting, where I have a lot of contact with the caregivers. The pathway to diagnosis, as you know, is long and hard. And so in getting to that point where the diagnosis is actually PH, we know that it's very difficult. So it's very important for the caregiver to, a couple points, is that after the diagnosis is that returning to daily life, be able to incorporate care for loved ones as well as, yourself. You might have to become a breadwinner, you might have to move. It's important to fit in appointments for medical management as well as your own appointments. It's hard explaining pulmonary hypertension to your friends as well as loved ones. But it's important to know not to be the super caregiver, that you have to take care of yourself as well. Set realistic expectations, and don't beat yourself up over normal and necessary, reactions to stress. Take it easy on yourself.
Nancy, what are your thoughts when you meet a family for the first time?
Well, I think one thing that I always say that we have one other nurse that I work with at the Cleveland Clinic, and we have 6 physicians, so we have a very large PH group and quite a number of patients. So I think I always say that the thing that we bring to the table with our physicians is to look at the social and the family support that our patients have. And a lot of times trying to determine what medication is best for our patients, you have to look at that social support. And because I've been doing this for about 10 years now, and I've seen everything from no support to helicopter family members that just don't let the patient have any kind of involvement in their care. But those are the family members' involvement is really key, or at least some sort of caregiver that can help the patients. But I think oftentimes we focus on the patient, and many times may not recognize the stress that the caregivers have. And I was doing a little looking into things, and I was really amazed that how many patients and caregivers really experience, things like major depressive disorders and stress disorders and panic attacks and things like that, unless the patient's family members come to us with those things, we may not recognize that. So I agree that you have to really make time for yourself and stay in touch with your family physicians, and to get help if you see yourself under some stressful situations, and not be afraid to ask for help.
Yeah. So I'm curious, how many of you are spouses or partners for PH patients? Okay. And how many have kids with pulmonary hypertension? Okay. All right. Young kids or teenagers? Teenagers. Okay. All right. Well, teenage years are tough, no matter what.
Whether you have PH or not.
Challenging.
It's very challenging, but I would say the first year, isn't it the first year is the toughest to try to understand the disease, to try to adapt your lifestyle, to try to be supportive, and all these things, and changes in your life and your loved one is the toughest. But once you achieve a better understanding and balance, and you know kind of what's happening in the next month, and what do you see and what you expect with each appointment, and you've made the first travel, you figure out what to do with oxygen. So if you get into the routine, I think it seems to be getting not necessarily easier, but easier to cope with. Isn't it true? I hope so. That's what our patients say. But we do rely a lot of our nurses to spend the time. It's easy for us physicians. We prescribe a pill. Okay, are you doing good? You do a 6-minute walk test. How do you do in school and whatnot? But then the whole team is a key from the medical side to interact with the patient and their families to understand the needs. And I would suggest be open to them and tell them, listen, I have this problem, You don't know how many resources we have available that we don't know to offer. Should you not tell us? Social services, financial services, some aids, nonprofit organizations to support financially with co-payments. Should you have issues, which everyone nowadays has these issues.
It's been an eye-opener for me. I mean, we certainly don't learn these things in nursing school.
No. And they change.
And the insurance issue has just changed dramatically in the
and
the
continue
last
to change
years.
just when you think you've figured it out.
Right. I just every day learn something new about somebody's insurance, and how many different options there are out there. And I'm not a social worker, but we can put people in contact with that. And I have had a few children, from probably as young as maybe 6. To try to help those families and keep the kids in school, and what does the school need to help keep this child in, to maintain a normal relationship with their school friends, and it can be very, very stressful. But I think sometimes you don't recognize the resources that are there. The PHA website is a tremendous starting point to find resources, but there is a lot of help out there. I know I recently found out one of our pediatric patients that had to travel quite a ways to get to their appointments, and had the old truck that didn't go and that needed to go kind of thing, and the finding out that in our pediatric group that they had social workers that could provide gas cards and help with all those kinds. And I had no idea, because mostly I'm an adult nurse, but it's something that we were able to provide for that family to give them some support. So I think that most PH centers are such large facilities that we do have access to all of those services, and it's just a matter of knowing people and know who to go to.
So maybe now we should open the discussion, and we're ready for any questions, any thoughts, any comments from your... Yes, there are microphones if you want to maybe hand the microphone, or so we can have everybody here. Yeah.
Have you, in the PH centers, considered or having not a social worker, more of a psychological help for the kids, especially for kids and teenagers, because I noticed that after my daughter was diagnosed and she got very ill in 2007, that a lot of her friends kind of didn't want to associate with her anymore because she, either they felt intimidated or they felt maybe insecure of having a friend who they may lose very soon or something like that. And that kind of took a toll on her because, she was losing friends and was unable to make friends with as she used to be. And from the parents' side also, I'm not sure if if the PH centers in general have services to support us from an emotional insight on how to deal with this. For the first year, I know I was in denial, and I didn't want to believe that anything bad could happen, and I didn't really fully understand, even though it was explained to me, I didn't fully understand what PH means and how was it affecting us. And the third point I would like to make is we all feel, and within our family at least, that we live in a big prison called the United States. Even within the United States, we are scared to travel because what if something happened on the way? We don't know how to deal with that. Like when we're traveling to a destination, we try to find out facilities but it's very difficult to deal with that.
So do you have a therapist or psychologist attached to the center?
We don't,
ideal.
but it's something that my coworker and I have brought up many, many times of when they ask us, what support we need, that, we could use a caseworker or a case manager or someone like that knows how to deal with some of these social situations. But, we have social workers, we have psychiatrists, we have psychologists that we can steer our patients to. And many of our teenagers, we have worked very closely with those groups. We've unfortunately had young people that turn to drugs. And in fact just lost one of those from that issue, and it was very difficult to deal with that situation. And but the psychology people at our group in our facility were extremely helpful in trying to manage that young man. But you do get into the situation oftentimes with these patients, especially with the IV medications and getting them into a facility where they're willing to manage those medications can really be difficult too. So I wish we had.
I wish we had. Unfortunately. Recognizing and treating anxiety and coping mechanisms with a newly diagnosed chronic disease is unfortunately not clearly recognized by the third-party payers. So I think mostly from the financial, burden of the centers, there's no money to have psychological support geared towards PH only. But we do work like you guys do with therapists. So and therapists doesn't mean that they prescribe you pills, but they have sessions and counseling. And the therapies there can be different ways to approach. If the family feels strongly enough that they can provide support, and it's the patient that needs help with coping, it can be a one-on-one therapy. But there are therapists who provide family counseling. Whether there are, there's couples that, go through tough times, that one is the patient, one is the caregiver, whether they have a kid and the parents need some help in communicating with a child throughout this process. So family counseling, I think, is very important, especially when you have kids.
I'm just curious, when you mentioned the insurance thing, how does that?
Yeah, so usually insurance
cover
covers,
that.
but you have to check with each insurance. But and it's not super expensive each session. But when you start committing, when you do counseling, it's a once a week thing. So it's a committed new relationship with a therapist who will start learning about your family in a lot of detail. And it does take time to open up. It does take time for the therapist to understand the issues
And to develop
and
a
try to
relationship.
help. And there are more moderators in discussion between different parties in the families, and kind of they geared the discussion between you to understand, to help you understand better what's in the other person's mind. Now, going back to traveling, no question, if you have a pump, it takes much more planning. You can't just think, all right, let's go this weekend somewhere. You know, you can't do that sort of spontaneous.
Or oxygen.
Yes, oxygen, pump. May I ask, is your daughter on Flowland? Yes. She is on Flow. So you have ice packs. Do you? She's on Voletri. Has she noticed any change in quality that she got rid of the packs?
Well, yes.
I'm sure she was on Flowland before, right?
I give you an example. One time we were on the highway and her pump malfunctioned. And I mean, so we're literally we had to pull off the highway and try to deal with that situation.
Yeah.
And I think somebody mentioned panic attack. I mean, every time I hear that sound, to me, it's just my blood pressure probably shoots through the roof, and I'm in a panic mode.
Yeah.
I think that, again, to mention the PHA website and to the finding a physician, and then if you're going to travel, identify the centers that are close that are around there. And I know my patients, I've gotten many calls to try to help them with that, because we know the people at the different centers, and I think just that they can have a list of where would I go if I'm in Orlando?
Right, exactly.
What hospitals know how to deal with this drug?
Yeah.
That's very important.
I think we have a few other questions.
Yeah.
I just had a comment. I'm a school psychologist. I work in the schools. I've worked with people that have terminal illnesses in the schools. Typically, we do tertiary kinds of things. But certainly for people in this situation, we bend over backwards to try to help them and their situation, their parents.
So what would you recommend for a family with a kid with PH who goes through, the ordeal of trying to understand the disease and help their teenage kid? Would you recommend family counseling or separate counseling, or
Both.
both?
And in terms of the panic attacks and things like that, mindfulness works really, really well. John Kabat-Zinn started in Massachusetts General back in the 80s teaching mindfulness to critically ill people, and found that all of them got better.
So what is mindfulness?
Yeah.
Tell us. Can you tell us in few words?
It's paying attention to the present moment, to what's going on right now. It's looking at the sensations as from moment to moment, in a non-judgmental kind of way. It's looking at them in terms of in greater depth. Okay, without resistance to them. Typically, when we're in pain, we try to push the pain away. We try to avoid the pain. We try to look in some other direction. If you instead look at it in great detail, the pain becomes a sensation rather than just like the air on your skin right now is a sensation. And you start to note that sensation. Oftentimes it gets bigger, but it has less influence over your emotional impact. As you get more and more aware of, more and more concentrated, oftentimes the need for pain medication goes down, or anxiety medication goes down, and just like with anything else, when you're in a more comfortable situation, you do better. So things improve.
Yeah.
Sounds like it needs a lot of training to achieve.
Yes, and there's a lot of availability of things. John Kabat-Zinn called his program Mindfulness. As I said, he started in Massachusetts General. He's got that program in 320 hospitals around the world now. It's gotten, because doctors and people, I started out with mindfulness, I don't know, 40 years ago. But because he did it in the hospitals and other people, there's now a lot of research out there supporting its usefulness with people.
Great, thank you very much.
Thank you.
We have a question here.
Maybe a question and a comment, small commercial. But the type of interventional help you were discussing, you mentioned, it's the billable type of help. Now, as the PH patient's physician, can you write a prescription that maybe the insurance company can see the family needs family counseling? Or do you have the resources available to let folks know what maybe free services are available in the county or the city, through the county or the state or the city or the school system? You know, maybe he's never aware that maybe the school system his daughter's in has got a on-staff psychologist, social worker, a resource to look at. But can you, as a PH physician, write a prescription for family counseling to support a patient, or the patient's caregiver?
But whether that's going to be...
So it's not through a prescription per se, but we have the resources and we give the family the contact to contact.
It's more like a referral.
Like a referral basis.
Just the paperwork to help with the billable issue of can I get my insurance company to cover this? Because a lot of that's
So it's like with any referral. Once you contact the referral physician, therapist, social worker, their office will talk to the patient's family and go through the insurance paperwork to see if they cover, because there are so many permutations. Every healthcare professional has a list of insurance. There's no way, if you're not within the same group, to know exactly who's covering, who's accepting what insurance, unfortunately.
And I think, we spend a lot of our days, I'm sure you do too, Rebecca, writing letters to insurance companies to
for
justify,
denials, things that have been denied.
And justifying such care.
The quick commercial is, I applaud your wanting to be thorough in your travel planning. The PHA website, great resource. You can go on and find the listing for every PH-type doctor in every state and country. And maybe a little assurance for you.
Yeah.
My wife's been on the Flowland pump for 14 years. We've done 2 transatlantic cruises. We've traveled the world. I understand the tension of how do I travel and have resources, but it's doable. PH is now a doable disease. Okay.
No, I think that's where the support groups will be tremendously helpful, to have you contact with people like our star here, Jim, who has gone through this and has tips, clues, and can give you advice.
And your pharmacies, the distributor pharmacies, the specialty pharmacies have helped me many times to get, a patient wants to go to Italy, and how are we going to get the medications to Italy?
They provide a letter, actually, too, to travel with. Specialty pharmacies provide a letter to travel with. So.
And, they're tremendously helpful in making, and I have one patient that's does ministry work in Rwanda, and he goes for 3 months at a time. But the FDA mandates that you can only get a month's supply of Tracleer. So working with the specialty pharmacy so that he could get a 3-month supply to go for, so that he doesn't have to give up that very important part of his life.
Yeah. We have a question there.
Yeah.
More of a comment, actually. Our daughter was diagnosed during her senior year of high school. And I guess we're very, very lucky because her high school embraced what was going on. And for instance, the school nurse got educated on the pump and if anything happened. When she started passing out, the nurse learned what was going on, and she took the time to educate herself about pulmonary hypertension. Mm-hmm. The staff was educated on how to handle emergency situations, school situations. She missed a lot of school that year, and every one of her teachers met with her, with us, to have a plan. An IEP was developed to allow such things as keeping her textbooks in school so she didn't have to drag them back and forth, extra time to take tests if she needed, things like that. And that transferred when she went away to college, which we're very pleased she was able to do because of all the support. And it's taking the time to learn what is out there. There's a lot more than we think when we first learn about this disease. So I just want to encourage you that it can all work out. It can all work out. So
that's a very good point. I was thinking specialty pharmacies have the resources not to teach the local fire department how to give first aid should you call 911, but they can go and touch base with the school nurse and not only try that, to teach her and educate her. Absolutely.
And not only that, for the gentleman who's discussing traveling, if for some reason you find that your daughter, you're traveling in a hospital that doesn't understand the drug, contact the specialty pharmacy and they'll dispatch a nurse, or they'll have the pharmacy within the specialty pharmacy call the pharmacist of the hospital to explain
and
this has happened.
To walk them through how to reconstitute this and how to do that.
One more point for the gentleman, because he brought up his problem traveling, is your specialty pharmacy generally has an 800 number, 24 hours. You can call on the pump problem. So right there from the highway, you could have gotten a nurse specialist, pump specialist that have walked you through the pump issue while you're sitting in your car. So, just a resource. Put it in your smartphone.
Right. And they know how to deal with the panicked patient on the other end of the line. It's kind of like I saw a news thing the other day about teaching people to do CPR, and the responder saying step by step, do this, do this, do this, and those the specialty pharmacy nurses are very good with that. And
yes,
they are. We were at a remote state park and had a problem with the pump, and within 12 hours, a new pump was delivered to this state park, which was, an hour from any highway. So keep that number with the pump.
It happens.
Call.
Well, I won't say a lot.
We have a question or comment here.
Yes, we have our daughter, which has PH for 3.5 years now. When she first found out, we didn't even know what PH was. And we found out what it was all about. And with her working at Walter Reed and was a nurse's tech herself, she loved her job. And it's like, when she found out, it's like her whole life, she just wanted to die. That's what she wanted to do, because she no longer could do what she used to do. It only took a toll on her. I think it took more of a deeper toll on me, because I was the one that wound up in the hospital thinking that I had a major heart attack, because everything had built up on the inside of me. And even with having my husband, even you having your husband on your side, there's time that you can't even talk to your husband because, see, You are hurting so deeply for your child because you know what your child used to do. And she no longer wanted to look at none of her pictures back then. She was in beauty pageants. She was doing everything, just free, doing everything. And she, as of now, she still don't want to look at the pictures way back then when she was coming up and the fun that she was having. And her friends and things, some of them, yes, stood by her side. And then some of them just completely disappeared. And especially when you have your family members, they're going to be there for a while. And then all of a sudden, they're going to disappear. And they will tell you, I'll be there for you, but they are not there for you.
Mm-hmm. Yeah, I've had that many times where a patient says, oh, I have lots of family. You know, they're in the hospital, and you know, we're trying to find people to help with their IV medications. And, oh, I have lots and lots of family members, only to go out and, you know, discover that there's no one that really wants to help them handle that.
I think that Joan's making a good point there. I mean, this is for the caregiver. How do we cope with that? Right. We've kind of focused a lot on the patient, and this is for the caregiver, this session. Mm-hmm. How do we focus on that? The things that I felt after my son was diagnosed, I know you're not supposed to take on the guilt and the stress of it, but as a mother, I feel a lot of it. It's in my son's idiopathic PH, but still in my heart of hearts, what did I do? Mm-hmm. How did this happen? And as Joan said, your family says, I'll be there. But slowly they're like trees that lose their leaves. Your family and your friends disappear. PH is a very isolating disease, except for your family that's spelled with a PH. You come to conference and you gain a family, because the family that you knew and the friends that you knew slowly fall away. And it's really hard. And I think we're all here in this session because of the stressors that we meet. And you talk about how we need to remember to take care of ourselves, but we're so busy taking care of our family ourselves that finding that time, that's all I hear, is you need to make time for yourself. When? Yeah. Please tell me when. I'm 10 years out. Please, tell me when.
We have a success
Jim
here,
takes his wife and goes on cruises.
Yeah.
As a mother, when? My house needs cleaned. Yeah. The laundry needs done. Well, just wait. I have to shop. So, as physicians, you work from 9 to 5. As nurses, you work from 9 to 5.
No,
but then,
never 9 to 5. Let's be clear.
I mean, you get to leave PH at the office, and I know that you go home and you think about your patients. Mm-hmm. But we're the ones that help with the pump. Yeah. We're the ones that do the medication. Yeah. When they turn cyanotic, we're the ones that go to the ER. You tell us to take time for ourselves and not to worry. And I have a son with PH. He's 28. So I don't have a little person. I have a big person. And I want him to have the things that every parent wants. I want him to get married. But when he goes purple, when he passes out, I'm the one that freaks out. Is he going to wake up?
Remember, in order for you to be strong and to be his support, you need to be well. So you need to.
Well, but I'm not. I know I need to do this.
It's hard.
I've been there, okay? And one of the reasons that I'm a PH email mentor is you can contact me. Anybody can contact me, and I'm willing to share.
But I'm a mentor too, Jim. But I'm just saying from another person's point of view. Yeah. The reality of the situation is we live under so much stress. Yeah. Joan had a heart attack. Other parents freak out. I'm proud of my son. We keep going on about the patients. We need to talk about us here, not our patients. The stress we feel is for the patients, but we need to have some coping strategies here for us.
Okay, and I'll be willing.
What I'm trying to focus on.
Let me visit with you. I'll help when I can.
In the back.
I don't know how this is going to come out.
No matter what.
But bear with me for just a moment. I went through with my husband a very debilitating disease that there was no treatment for. Nothing we could do but wait from day to day. I had the responsibility of trying to go on and keep working and take care of the household problems. I was very fortunate and blessed to be in a situation where insurance paid for help for him. I had 24-hour-a-day help with him to be able to do that, and I would take the time. Sometimes I'd start home from work and cry most of the way there, so that was my release. I'd think, when I get home, we'll do so-and-so, but tears came. About 9 years ago, my son, who is an architect by trade, loved his work. He was diagnosed with PH. My health has been fairly good in my life. I've had problems here and there, but as a whole, for my age, my health has been good. I thought, well, why him and not me? He's a younger man. He's got a job. He's got a profession he likes. He does well with it. And why him and not me? But I didn't dwell on it, because we have no control over what illness we're going to get or what some of the things we are going to face. Some things we bring on ourselves, but this is something you do not bring on yourself. So I have my ups and downs, but my son is now, he will be 55 years old, his birthday. He takes pretty much care of himself. I am there to help him. I help him with his medication and mixing, and he's on IV Remodulin now. He's done quite well with it, with the medication. We sit down together and mix his medicine. I don't work his pump yet, but I'm there. And I let him do everything for himself that he is able to do. He has days that he doesn't feel like doing anything but sitting in the lounge chair with his feet propped up. Maybe half the time sleeping, working a puzzle, reading, or he might get up and go to bed. But I'm there, but I let him do what he can and what he's able to do. Most of the time I prepare the meals, I do the laundry, and I do the housework. He can't hold out to be out in the heat. The heat in South Carolina bothers him pretty bad. But I have found to take each day at a time, each hour at a time, each moment at a time. And I'm not saying I don't get nervous and keyed up if something goes wrong and he has to go immediately to the doctor. But he has a mind, he's very conscientious of his own care, and he encourages others. He leads a support group. About, I'll say 6 weeks to 2 months ago, in his Hickman, he had gotten a little bit of, it didn't look right. Do you think he waited 2 days to call the doctor? He called the doctor immediately. He did have a little bit of infection. It did not get severe. He called immediately. He had been on his antibiotics, got up on a Saturday morning, and the place did not look like he thought it ought to look. He got on the phone, called the doctor on call. He will not. So adult patients, and that's what we are supposed to be, parents of adult children. Let them have as much responsibility for their own care as they have. Just be there for them and let them know you're there for them.
Yeah, I think it's crucial. And while you're getting thank you very much for your comments. And we all learned that by supporting our loved ones through a partnership rather than through taking over their problems and their illness is crucial in the health of your relationship and of their coping. And your coping too.
My daughter's just been diagnosed for 1.5 years. And at the beginning, I was just on this treadmill of worry. And, you know, I'd sit in bed and I'd read a book and my heart would start pounding. And I'd think, oh, do I have PH? You know, am I going to have a heart attack? And one day I realized that if I didn't take care of myself, I wasn't going to be there to take care of her. And, you know, I went to see a counselor and she said, how can you sit there and be so calm about this? I would just be a basket case. And she said, with the thought that, have you thought that you might outlive your child? And I said, you know, I need to outlive my child because I might be the only one to take care of her. And so I just like exercise for stress relief. I am in a hiking group, and I do it every Monday, and I don't schedule anything else on that Monday. And that's a day where I can go and be with people, and I don't talk about my daughter's disease because I don't want to bring it up. I don't want to push people away by constantly dragging my friends down because they're there for a good time. You know, when I want to talk about it, I can call my sister or somebody else who understands. But I think if you constantly burden your friends, they don't want to be around you. They want to have a good time. They don't want to listen. So maybe find somebody like your support group to talk to. So Mondays is, you know, just totally my day. I go hiking. I have a group of girlfriends. We meet and play cards, mahjong, you know, and don't talk about anything but really light and frivolous things. And it gets me out and it gets me happy. And I realize that she's not going to die tomorrow. She's not going to die the next day. And I can't be on the treadmill thinking that she's going to die tomorrow. I just have to keep myself strong. And when I reach a critical point, then I will worry. But I'm not going to let myself worry every single day. And that's just for my own health. And yes, it might seem like I'm kind of putting my head in the sand or closing the door, but I close that door, and I'm not going to open it until I need to open it and really
I think that's excellent that you do schedule, you know, and have a day for yourself, and that, you know, that you make that happen.
And that commitment to yourself.
Absolutely. I think that's critical. Even if it's just one day a week, at least you're in, maybe in the future as you work your way off that treadmill, that you'll make it 2 days or, you know. So commend you for that.
I know that these are all good. I know that we've really completely answered her. Where does she find her time? Which a lot of the caregivers, where do I find my me time? I know my adult PH patient, I know her sleep patterns. We all know there's good days, bad days. But when she's asleep, I've got a me time. I may have to vacuum the house, but I do it with my classic rock radio songs on my iPod. And I bop to vacuuming the house. My me time. It may only be 20 minutes. It may only be 30 minutes, but I've found it. You know, I know her sleep patterns. I know if she's having a bad day and just wants to be in bed and I got to bring the meal or I got to do the stuff, she's eating. That's going to occupy her for 30 minutes. I can run out and walk the dog around the block, and that's a me time. 30 minutes, 20 minutes here, 20 minutes there. I change my sleep pattern. She doesn't like to wake up. She's not a morning person. I get up 5 o'clock in the morning. I don't even have to set an alarm clock. I got 3 to 3.5 hours of me time that's mine because she's asleep. I know where she is. I know she's safe. I know she's doing well. And I can do what I need to do. I can go out and hammer a nail in the garage. I can do things like that. So you can find your me time. Just look at your schedule and put it during their sleep time.
It's a great idea.
Prioritizing is a huge, and it's a huge task for all of us, no matter whether we deal with a loved one with a chronic disease or not. even among our relationships with the spouses, with the kids, we all need some private time. And to be honest with you, the laundry can wait another day. What the heck? If it makes me feel better for the following day, I'll do more laundry, you know? Any comments?
I really agree with what you said at the back, and it's taken me, my daughter was diagnosed 5 years ago. She just turned 32. And I think what I've how I've evolved over that 5 years from those days of the first phone call when a doctor from Halifax phoned me and said, Mrs. Dolan, your daughter has PH. She can't live on her own anymore. You need to come and get her. So we've all got a version of that story and that panic and fear and paralyzing fear. You don't even know how to move. So in the last 5 years, my daughter's name is Emily, and I am her main caregiver. So I've moved from panic and support to joy. And I don't know how it happened, but I've just decided, rather than being in that constant panic state, because it is very wearing on our health to be in that state all the time, is that particularly when I'm with Emily, whether it's, at the Toronto General Hospital with her for her 3, 4, 5, 6 hour appointments, that we find joy from the moment we get in the car. I get the Tim Hortons coffee. Does anybody know about Tim Hortons? Good coffee. And the breakfast, and we sit on the Don Valley parking lot to get there, long highway that you sit still on so you can drink your coffee and have your breakfast while you're sitting in traffic. And I found, she normally says to me, Mom, I'm just going to sleep. And I say, okay, dear, put the seat back and sleep. Next thing you know, she's talking. And I feel so grateful to be in that car with her and listening to her. It is, and then I started saying, this is amazing. I have all these hours with my daughter, who's now 32, that you normally wouldn't have those hours with your 32-year-old. And she's sharing her life with me. And so I started really experiencing joy. And rather than saying, oh God, I'm on the Don Valley parking lot, I'm going to be here for 2 hours to get to an appointment that's going to take 5 hours, I don't think that. I reframe how I think. So that reduces my stress tremendously. And I really, really am so aware of the joy of spending time with my daughter, because none of us know how long we have with our adult children or our teenage children. And I decided I don't want to be in that place of panic and excessive worry all the time, because it would be hard on both of us. So and I, like you, do exercise. I do aquafit. And that is so wonderful for me to de-stress me and to take care of an illness that I have. So I think sometimes just reframing how we look at things can be a big help in keeping us more peaceful and more present to those that we care for. So I'll recommend that you find joy in moments that you share with your family. I know I like you feel, I know there's a constant, I use the word vigilance. So when the phone rings and I know it's Emily, I can see her name. You kind of do that. And then when I get, hi Mom, I think, oh, phew, something good. But when I get Mom, and then I take another breath and I say, yes, But most of the time I get, hi Mom. And she's a wonderful woman. She, after she was diagnosed, she had to quit school. She was doing her social work degree in Halifax, and she had to defer that. And once she started on her medication and was able to go off oxygen, and she decided to go back to school long distance. So while she was still sort of recovering, she finished her social work degree. That was the best graduation I went to. And she's now working as a social worker with people with HIV/AIDS, and I'm so proud of her and feel very joyful about that. And again, allowing her to live her life and not being that helicopter parent. She's now working on her master's degree. Who'd have thought 5 years ago? So I'm looking forward to that graduation. So be joyful.
Thank you for your comments. Wonderful. Yeah, and I think, I think having those discussions with, your partner, whether it's your adult child or your spouse, that to have those discussions of this is, what I'm feeling, and I would like to, set aside just a few hours of time for myself. And I bet if you had those discussions that that person would say, sure.
We have a comment in the back.
I wanted to give a couple of more resources. If your child is sick, there's in the United States what they call a 504 plan that's eligible for any child that has an illness that affects his performance at school. The one problem with 504 plans is that the parent is the one that keeps track of things and makes sure that people do what they're supposed to do. There's legislation in place that teachers are personally responsible to follow the 504 plan, but there's no organization at school that follows that necessarily, that makes that happen. More restrictive than that is the special education plan, and somebody mentioned an IEP plan. Oftentimes schools don't want to do an IEP plan if it's not directly affecting the child's performance at school. But you can still get a 504 plan. One of the other resources that I wanted to make available to the parents, and I just so love the last speaker because she so much reminded me. I came here today because I wanted to feel sorry for myself. And I wanted some outlet other than being in my own head. And when I walked in here and heard you talk about the children, I'm sorry. It put me back into, oh my gosh, I've got all these resources. I know how to do this stuff. I know how to do it really well. But at the same token, from, in my own world, I get upset and overwhelmed. From the me time, for me at work and at home is often a different breath. It's reframing what it is I'm thinking about. If you're thinking about how bad the world is, and you change it to being grateful for the next breath, everything changes. There's a company called HeartMath that has some devices that monitor the variation in beat to beat of your heart. It's the best device that I know of training somebody to stay in the moment from moment to moment for a period of time. They're at heartmath.com or heartmath.org, either one. It's HeartMath, so pretty easy to remember. In terms of mindfulness, they teach it with this little device. I don't know how useful it would be for people that have PH themselves, because the PH heartbeat could be very different than a regular heartbeat. But wanted to give you at least those three resources. Thank you.
Thank you very much.
My daughter was diagnosed in January 2010. She was 15. She's now 17. She'll be starting her senior year. I homeschooled her so she doesn't go to public school. And I've homeschooled her for much longer than before her illness. But you had said that you thought that the first year was the hardest. And I think it's the first 2 years. Because this year has been the hardest for me to try and cope with her illness. I don't know about her. I think she's still in denial, but for me, it's been hard this year.
Yeah, so this is where counseling would be a wonderful support for you, and probably counseling for you yourself to begin with, and maybe family, and chat rooms at the PHA website. You have and you will find friends that you never thought about that share the same problems, and that makes you feel you're not alone and isolated. You're teaching your daughter, you probably spend a lot of time at home, right? Mm-hmm. So reaching out through internet, which is a wonderful gadget, right? Yes. It puts us in contact with wonderful people we may not see too often, right? And I would recommend counseling for you, to have you learn how to do that me time, how to create those moments to enjoy them and not think about the next step.
And I think, it may not be the first year, it may not be the second year that's hard, but there's so many changes from one year to another. And maybe you have one event, whether it's an Hickman catheter infection that ends up being a 2-week hospital stay or something. You just have to deal with those situations, and you never know. So you get over that first year and you think, oh, we're cruising along just fine, and then something else happens. And having those support mechanisms in play and those friends out there can be tremendous help.
We have a warrior here in the back.
He's trying to keep us on time.
Let's get in one more question before we end here.
Oh, wait, we got the light source coming up.
That would be my light source. I want to remind everyone that these sessions are being recorded and they're eventually going to end up on the PHA's website. One of them is that took place this weekend was Traveling with PH. I would recommend that you make sure you access that and take a look at that. You'll get a lot of helpful tips.
And Jim, our last comment.
Can any of you speak to, I reviewed a poster display out there about a sociological study that one of the conclusions was the helicopter parent, the overconcerned, the stressed out parent actually affecting the disease process of their child patient. Can y'all speak to anything like that at all?
I did not see the poster, but I know both from having the parent-child relationship and spouse relationship with adult patients, just the caregiver taking over everything. It makes the patient feels weaker and dependent and puts a burden on them. And you need to help empower them. Let them take most of their pump care. Let them know how to do it. And exactly like our wonderful speaker in the back said, be in the back should they need help, and have them the comfort of having a backup, but have them take ownership of all the things that are around their illness. And the relationship between you and them will be stronger and more powerful if you treat them as partners, whether they're kids or adults, rather than, I'll take care of you, I'll do everything for you. It will be an equal relationship. So I think with that, having said, we had a wonderful session. Thank you for opening up.
Thank you. Thank you.
And have safe travels home.